Good afternoon. I'm Duncan Weatherston, one of the founders and the CEO of Small Digital Health. We are a data platform focused on open standards for both the scalable use of data and clinical reasoning. We're happy to be a sponsor of Sequoia and the event. Really appreciate the hard work done by everybody to pull this together. Fantastic conference as always. Just want to quickly announce who won the earbuds. Today's winner was Michaela Baptiste. We'll be sending you the from ASDP. So thank you very much, everybody. Have a great day.
All right. Well, I don't have any earbuds to give away. I apologize. My name is Chantal Worzala from the Sequoia project, and we are going to have a very fast-moving government affairs roundtable here today, and I'm very excited to have with me Lindsay from Troutman Pepper, Lauren Riplinger from AHIMA, and Zeynep, who is joining us from NewYork-Presbyterian, which is a new Sequoia member, and Zeynep also sits on the federal high-tech. So what we're going to do during this time is have Lindsay give us an incredible flyover of everything that's going on in Washington right now, and then we'll have a panel discussion on some of the key issues that we're facing in health IT today. So Lindsay, take it away.
Yes, let's roll. Okay, thank you, Chantal. This has been always so fun to do, and end of the day is not too bad either, because I know it's happy hours on the horizon. But I'll jump right in. I won't cover everything in government affairs because there is far too much going on, but I'll hit some of the high points and picking up on some cues on what everybody's interested in, try and cover some of those topics. But just to give you a quick agenda of what I'll discuss here before we get into the panel discussion, what's going on in Congress post-election? My goodness, an election of a century here. Where are the numbers? What are we looking at? What's the end of the year look like? And then, of course, the 2025 outlook. By 2025 outlook is what's on the horizon for a new administration, a new Washington, and then we'll get right into the panel discussion, which is always exciting. All right, so the math is important. This is really, in terms of Congress, this is actually keeping us on our toes. Not so much anymore. We now pretty much have a good feel for what we're looking at the House and the Senate. But currently, as it stands, we're in the 118th Congress in a two-year cycle of Congress where we have 220 Republicans with the Republicans in charge of the House and 211 Democrats. If you do the math, yes, that's not 435. It's because there are 4 vacancies that include a member that resigned, Matt Gaetz, and then several Democratic members that have moved on to other positions. But those will get filled in the new year. So coming up in the 119th Congress, Republicans will have a one seat down. So 219 Republicans still in charge, still have the gavels. 215 Democrats still doesn't add up to 345. So Democrats did gain 1 seat. Those margins are super slim. With those vacancies, when Trump takes office, you can see here the numbers tick down and tick down and tick down, where on the Republican side, you're 219 going into a new Congress, 218 when Congressman Waltz steps down to take on a national security advisor role, and then TBD on Congresswoman Stefanik when she gets confirmed for the UN ambassador position, puts the speaker in a very tight spot. What that means is he's going to have to do a lot of brokering within his own party, the way that he did this past Congress, where we had, our short memories of when Speaker McCarthy at the time having to deal with getting items passed when he did not end up keeping a speaker gavel. So Speaker Johnson will have a lot to do, and he might have to negotiate with some Democrats to get some bills across the finish line. Okay, going over to what the House is also going to be looking like, which I think is going to be really important to this crowd. So what are the committees going to be doing? Who's going to be in charge? What are their priorities going to be? Are they going to be able to work together? So just as of this week, some breaking news. Brett Guthrie did end up winning the gavel for the Energy and Commerce Committee. Brett Guthrie is from Kentucky. He's been serving on the committee for a long time. He's been in Congress since 2009. He is a West Point and Yale grad, smart, energetic, a lot of fun, quite frankly, but also very focused on a number of policy areas, including the drug supply chain, the opioid epidemic. He'll be tackling a lot of those issues that the party previously tackled under Kathy McMorris Rogers, but I think he'll have his own little spin on it. So I won't go in too deep into all the other priorities since we have a short amount of time, but I wanted to point out Brett Guthrie. You see here on the image that he actually beat out Bob Latta from Ohio for that position. So keep an eye out for what Brett Guthrie's going to be doing. And then, of course, the subcommittee gavels will be announced early in January. So we'll know who runs those subcommittees at Energy and Commerce, Ways and Means, and Appropriations. But yes, so the other two committees listed here, those members had those roles previously. All right, over to the Senate. Margins still slim, but not quite like what we're dealing with in the House. So the Democrats currently hold the Senate at 51 seats to 49 Republican seats. This was a sweep election for the Republicans in the Senate, and they now will have, going into the 119th, 53 Republicans and 47 Democrats. So they had a plus, Republicans had a +4, so it was a pretty big victory for them. It didn't necessarily lead to, because Leader McConnell announced that he would be stepping down from his leadership position, and that made room for John Thune to recently win the leadership role for the Senate. He's been in Congress a long time. He's been in the Senate a long time, since 2003. And he's going to lead his conference to work with the House and most definitely work with the incoming Trump administration. Big priorities ahead, including getting political nominees and through confirmation, votes on the floor, budget reconciliation. Whoo, brace yourself, that's going to be a big one. Debt ceiling challenges and all of that. So the Senate definitely has their hands full, and Thune is the new leader. Keep an eye on that. He has worked on healthcare policy over the years and been on jurisdictional committees. Speaking of jurisdictional committees, so we do have 3 other committees that are, I would say, the sister or counterpart committees to the House, with the Help Committee, the Finance Committee, and the Probes Committee. Senator Bill Cassidy taking on the role. It was touch and go there for a little bit because Rand Paul actually has seniority over him on the Help Committee, but chose a different gavel. So luckily for Bill Cassidy, a gastroenterologist, longtime healthcare committee member, leader in healthcare policy, he will be chairing the committee and stay very busy with his regular platform, transparency, healthcare workforce. He does care about health technology. He was serving on the House Energy and Commerce Committee when 21st Century Cures was passed. And he's definitely someone to watch in terms of the policy issues that you guys might be interested in. Same thing goes for the Finance Committee. They're going to be very busy managing a huge tax package that the president intends to move through. So you might not see as much healthcare moving through finance. And appropriations will continue to deal with the challenges that they always have, and that's the end of year slam through to make sure the government gets funded and we don't shut down the government. But yeah, so again, keep an eye out for what the next steps are with Senator Cassidy coming from the Help Committee, but also don't forget there's an E, an L, and a P in that committee that take up a lot of time as well. The health part is important to him, but he has to put a lot of priorities on the table and manage those with bigger staff, a little bit more of a budget, and a louder voice. All right, so what do we have left? 7 days left. What's actually going to happen before the end of the year? I can pretty much tell you 100% of the members of Congress do not want to stay past December 20th. They want to get everything done. So lame duck agenda, obviously we have to fund the government. Continuing resolution, we've been hearing March. That's what President Trump wants, to be able to better position himself, to have all of his nominees in. All of his nominees will not be in by March. But he'd like to have some stability going in, so he's asked the Speaker to push this to March, and even with the pushback from appropriators, they really want to just make sure that it's easy for Donald Trump to go in. I don't think it's going to be easy. March is going to be wild. Buckle your seatbelts. The National Defense Bill, as of this week, some breaking news. Yesterday, the House passed the rule the defense bill should be passed, expected today, maybe tomorrow. The Senate will take that up quickly. That's a must-pass bill for the last 60 years. Disaster funding and some of the extra anomalies and not pay-fors, but things that want to be tacked on are going to be part of, potentially attached to a continuing resolution that should be taken up next week. The goal is to get Congress out of here before Christmas. I've been in Washington 20 years. I'm coming up on my 20th year on December 27th. And the beginning, we always passed appropriations bills. And it really wasn't until we had a lot of these fiscal hawks come up and say, We need to question how much we're spending, where we're spending it in government, which has caused a lot of these fits and starts with continuing resolutions, government shutdowns. But what's been poll tested is shutdowns are not attractive to the general public, so let's move on. So another piece of that is the disaster funding, like I said, that one is attractive. That is bipartisan. All these members of Congress want to make sure that they take care of those states that were ravaged by these recent storms. So they're debating that now, figuring it out. We might see some text this weekend. In terms of healthcare, I have to mention the big picture items because you got to set the table in terms of where do you fit in healthcare in 7 days. There is a proposal for health extenders. The list here, I won't go through all of them. It's being negotiated right now between the House and the Senate Democrats. The House Democrats and the House Republicans each have their different proposals. They're working that out. My guess is they'll get a real slimmed down version of a health extenders. We could talk maybe about this later. Lauren is tracking this as well to make sure some critical pieces get done, like telehealth expansion, maybe community health centers, but we'll have to see what they end up coming up with. It's all happening within the next week. Okay, so really what you guys want to know about is what's going on in the Donald Trump administration. Kind of break this down with the players, and then the next slide is the game. So I have a list here of some of the announced intent to nominate people that Donald Trump would like to see in secretary roles within the cabinet. So you have HHS secretary, intent to nominate Robert F. Kennedy Jr. I think that's obviously been on the tip of everyone's tongue, wanting to know what's he going to do, how's he going to manage and reshape HHS. He does have a mantra and theme of the making America healthy again. I think he means it. He will genuinely do everything he can within his abilities and utilize every tool at his disposal. Some of the things that he wants to do are not actually under HHS. They fall under USDA. So he'll have to work very closely with his partners and peers, and there will likely be a lot of intergovernmental activity happening if he gets confirmed. I feel, if I were betting, most Republicans are going to want to confirm Donald Trump's choices for cabinet positions. So I would say he will make it through. He will have stringent and tough meetings. He's having them this week right now with Republican senators. And then he'll go through hearing processes and a potential early vote for his confirmation. The president also announced Jim O'Neill, who is a former Bush appointee, as the deputy secretary of HHS, number 2 position. There is no OASH yet. That's the assistant secretary for health. That one should be coming soon. I'm not going to expend a lot of energy on ASTP-ONC. There's names floating out there. There's all sorts of talk. But remember, all right, Mickey, keep it down. No, Mickey, you can come up here and talk to us about that if you would like. No, but there's so many sub-agencies that have to be selected in some of these positions. This is not a confirmed position. The Senate does not take this up on a confirmed. It's a political appointee. Mickey is the only political appointee. Mark Nee was kind enough to remind me of this last week. The only political appointee within the ASTP-ONC. So that does mean something in terms of the rest of the organization operates as staff of the secretary. So this all has to be worked out, and it's very important. And if you recall, our memories, again, are not that short, but Donald Trump moved a lot of people around in a lot of jobs. So whatever job somebody gets, they may end up with a different job 6 months later if they get nominated or they get confirmed. So keep that in mind. And the rest, I think you all have seen, Dr. Oz, who ran, I think people forget that he recently ran for Senate. He's had political ambition. He wants to get up here. He wants to make change. I think follow every word he has to say. He's got to figure out who's going to be his Medicaid, Medicare director, CMMI, all of those different agencies that fall under CMS. And then the rest are just other ones I wanted to point out that will be key to making healthcare policy going forward. I could have added 20 other people on here, but I wanted to do a little plug for Doug Collins because I think he's going to make an incredible VA secretary if he gets confirmed, which I think he'll sail through with flying colors. All right, outlook. So the game, those are the players. What's the game? So right now, ACA repeal and replace. I'm just sick of hearing it. I think the Republicans are too. They aren't going to do it. They're going to look at different pieces. So there's the employer mandate that does pop up every single election year since this legislation was passed. That gets discussed. There's some subsidies that expire. That's something that Congress may consider and utilize as a pay-for future legislation. Budget impoundment. This is kind of a new one. This one hasn't really been brought up in a while. I think it was in Nixon is the last time this was a major issue when they were utilizing Budget Impoundment Act to fund or not fund agencies through the White House. So I think they're going to utilize this. And the OMB director, Russ Vought, is a savvy, savvy budgeting expert. So I think they're going to be working very closely to figure out how they may use that tool for or against funding certain agencies and activities of the government. Cybersecurity, I'm going to leave that one to our expert panelists. They're going to talk a little bit about, but there's definitely some activity that's going to be happening, I think in a bipartisan way. Yes, DOGE, the Department of Government Efficiency. It is not a department. It is not something that's going to be passed into law. I would almost equate it to, don't quote me on this because I'm sure they'll have some other technical way, like a FACA. I think it's going to be an advisory, a think tank. They're going to be able to provide input, and the president takes their opinions very seriously. One of these gentlemen ran for president, Vivek Ramaswamy. He takes what they have to say very seriously. And in those pictures, it's very serious. I see that we have the kid on Elon's head. But either way, deregulation is the theme of the next administration. So I know everyone's going to be keeping an eye out for that, but they can only deregulate so much in a certain amount of time. So I think they're going to be prioritizing areas that may not even be healthcare, but eventually they will make their way to healthcare and figure out what makes the most sense because they're going to want to tap into those dollars. Drug pricing negotiations will continue. HTI 2, which I had on here, I just knew it would get dropped. I'm just kidding. I did not know. I predicted a Friday drop. That's usually when you guys do that kind of thing. So, we can discuss that a little bit more later in the presentation or in the panel. The Inflation Reduction Act, they're going to be picking that thing apart, man. Just expect it. So I don't think that really, and there's some impact on healthcare. And then so on and so forth. You see here, I will point out Medicaid reform. That one is one that Republicans will continue to sort of pound their fist on. They don't want to eliminate Medicaid. They want to reform it. They want to have better policies and processes at the state level. So expect to hear a lot about that. And if you're an organization that works closely with your state Medicaid office, please make it clear on the significance of Medicaid to your organization and how it works in your state. So this administration is informed before any decisions are made. That is my recommendation, and I won't send you a bill for it. PBM reform. PBM reform is one that I think members of Congress desperately put pharmacy benefit managers. This is a political hot potato that I think will continue to get the limelight in the committees of jurisdiction. And then public health agency reform, something that obviously continued from COVID is a challenge for everyone. But the CDC now has a confirmed position as the director. So it's very serious. There'll be a lot of oversight over the likes of the CDC and FDA, NIH, ASPR, you name it. And then, I have a little note here that Trump administration will likely freeze all regulations when they take office. All is a stretch, but might probably be the ones that they care about the most. Okay, I don't need to repeat what Mickey already talked about this morning, but I thought it'd be nice to be able to put up something here just to look at the ASTP, ONC, and TEFCA continuity. You guys have heard enough about TEFCA. You've talked a lot about it. I'm sure the conversation will continue, but what I will point out is that it could be, I wouldn't want to say a target, but it could be under review by the Department of Government Efficiency. What are we doing here? There is a new czar over AI and technology that will be coming in, David Sachs, and he's probably going to want to look and see what's happening with healthcare and health technology under the umbrella, the overarching HHS umbrella. So you can see here where Mickey and his team put together their chart here to show exactly how the newly formed agency will be managed, and I think it's critical to just keep an eye on that and see how the new administration may handle it. I'm going to quickly do this one because we're going to talk about AI in the panel, but AI is the topic. I know we want TEFCA to be the topic, but AI really is the topic. Biden put forward a huge executive order, really wants to reinforce it. Trump administration will effectively pull a lot of that back, even though most of it hasn't even gone into play. As much as we want to move forward on AI, it is super complicated, super sticky. Republicans and Democrats want to work together and figure it out, but I do think there's some politics involved in allowing, the Biden administration to basically get the first say on what they're going to do on AI. That's more of an opinion than it is exactly what's going to happen. I'm very curious to see, and I already mentioned David Sachs, venture capitalist, PayPal guy. He's going to have a big say in how the administration is going to manage AI. I note here that there was a little pushback from a letter that came from the incoming chairman of Energy and Commerce and Congressman Crenshaw and a couple couple of other members about the use of the AI assurance labs. I'm not going to go down a rabbit hole on that, but basically they're a little concerned and they want to consider what's going to happen with the AI assurance labs. How's it going to be funded? What's the fairness, equity, blah, 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 blah. But all in all, they're just really curious of what's going on at ASTP O&C. I think that's a fair thing to ask, but I think they need to get educated about what this all means. So.
All right, Lindsay, I'm going to have us transition to our discussion,
okay.
But I love having this up on the screen
You leave this one?
so folks can reference it as we have our conversation.
Sure thing.
Because we don't want to stand in the way of the Q-Hin dating game. So obviously we're in a time of a little bit of uncertainty. But Lauren, thank you so much for serving on our privacy and consent work group. We really appreciate all the members of that work group. But with that hat on, that Sequoia Interoperability Matters hat, what are you thinking about privacy in the new Congress and the new administration? Are there any privacy policies that you think are coming down the pike? And how would that maybe align or even conflict with some of the action we're seeing in the states?
Yeah, it's a great question. I mean, I think, the biggest thing in terms of privacy policy from Congress is a national privacy law. Under the current chair of the House Energy and Commerce Committee, Cathy McMorris Rodgers, this was a top priority for her. But as Lindsay mentioned, we have a new chair coming in, right? And if we look back at the 117th Congress, when Kevin McCarthy was Speaker, there are a lot of Republicans that held their noses and voted for that bill when it came to the House floor. And those votes have been subsequently lost in this Congress to the point that that was one of the reasons why the bill didn't get out of committee and come to the House floor. So there's going to be some pretty big hurdles in the House to kind of get to an agreement of pushing a national privacy law, and a question mark of whether or not it's a priority for Guthrie. In the Senate, I think the important thing to keep in mind is that the Senate requires, even though the Republicans have a majority, a slim majority, you need 60 votes for cloture. And what that means is, in order for debate to move forward, you need 60 senators on board. And there are some exceptions, right, in terms of reconciliation and other things like that. But what that means politically is that you're going to need additional Democrats to come along with those Republicans to reach an agreement to move any privacy legislation. And so there's a big question mark of, are you going to be able to bring Democrats along on issues like state preemption and private right of action? And so I think we may not see as much movement from a congressional perspective. From the administration side, I think a lot of it's going to be driven of who's sitting in that seat as the director of OCR. We know that Roger Severino, even though he wrote portions of Project 2025, he is considered out in terms of consideration for that role. And so I think there's a big question mark of, are you going to get a director that's going to be focused on privacy policy, or someone who's much more focused on the civil rights division within OCR? So my gut tells me we're going to see a lot more complexity as states continue to kind of enact their own provisions related to privacy before we get any relief.
All right. Well, and Zeynep, as a healthcare provider organization, really all of the regulations come down to the care that you provide, the information that you share and use. Privacy, security, information blocking, TEFCA. You don't get to pick one. You have to do them all. And then you have your state and local policies as well. So as an organization, as you look across that landscape, what are the policy changes that would enable interoperability on the ground? What are you all looking for?
Yeah, we talk about this and think about this all the time. Healthcare in and of itself is so complicated and so regulated. And as you mentioned, the privacy, security, information blocking, TEFCA rules are also very complicated as regulations go. And so we are constantly thinking about how we balance compliance with our operational, just practical challenges and making sure we can do both, right? And so, but we're also very supportive of interoperability, want to exchange appropriately and share information in the right way. And that's sometimes really hard to do when there is either are regulations that are at odds with each other, in conflict with each other, or just on the face of it, so complicated that it's hard to tell whether they're in conflict. An example for us in New York, at NewYork-Presbyterian, has been our state consent rules for sharing and accessing information through our health information exchanges, and maybe a policy, or I think we could take two approaches. We could work to harmonize, collaborate, have states and federal government really collaborate on the ultimate goal of interoperability and agree to harmonize those rules, or take a heavier-handed approach and have federal preemption of some of those rules. And I don't know which is better. I do wish and hope for one or the other, and look forward to that. Another area is around information blocking. Again, a rule we wholeheartedly support, really complicated to implement. And every day as a healthcare provider, we find new scenarios or cases where there are gray areas or questions raised. The latest for us in New York has been around HIV test results, positive test results in particular, and we're grappling with how we balance sharing information with patients, again, quickly and appropriately when it's available, but at the same time balancing that with state regulations that require us to educate and counsel with those results, and then the clinicians just desire and need to support their patients in those very life-changing outcomes. And then lastly, around interoperability, we as a health system really support a lot of our community providers and try to bring them in and connect them, but those non-health system providers still struggle to connect, and I don't know that it's regulations necessarily, but standards, plug and play technology. I know we talk about this a lot in this room, in this forum, but I'll just say from the field, we still have a lot of partner providers that are not connected and can't easily access our information. We certainly can't there. So some policy initiative, collaborative initiative around that. And again, I don't know that it's regulations, but it's efforts.
Yeah, bringing everybody together to really get the data moving. Yeah. So I'm going to stick with you, Zeynep, and talk a little bit about HITAC and ASTP. And do you have thoughts about the priorities for the incoming ASTP and the HITAC as it continues its work? And I might open that up to our panel as well.
Yeah, and I think we were talking about this as we were preparing. I think, again, this forum and a lot of the issues we tackle in this forum are bipartisan issues, right? There's widespread support for interoperability, cybersecurity, AI, all of it. And I think the agenda that the ASTP currently has under Mickey and the issues we discuss at HITAC are spot on, really. And if I had to pick one right now that's really hitting home for me, for NewYork-Presbyterian, it's the public health focus, and it's just urgently needed. We still report to our state government, I believe it's close to 90 data elements manually every day. And it takes several FTEs to do that. I'm not sure if the data is useful or used in any way. I know that public health data is critically important. So that focus on creating a mechanism to have structured public health data shared in a standard way is just, I think, a really important priority, and I'm really happy to be part of the HITAC to advance it.
What about you, Lauren? What would the priorities be from AHIMA's perspective?
So I think there's two things that come to mind for me, and one will probably not shock many people in this audience, because being with AHIMA, and that is one, the issue of patient matching. We still have to fundamentally figure out how do we accurately match patients to their data. And as we continue to build TEFCA going forward, I think that's just going to be a critically important piece. We're exchanging more data flows. We have to figure out this fundamental piece. And I know many of the people in this room that are working on that. So I think that's a key priority. The second one I would say is, as we continue to adopt technical standards in regulation, is just really making sure that those technical standards support the needs of our end users, whether that's a provider, a patient, a health information professional. We have to make sure that these standards work for us so we get to that future state that we all want to achieve.
That's great, and I'm going to take a moment right now, because you mentioned end users, getting things working on the ground, privacy and consent. I do want to make sure that this room knows that the privacy and consent work group that the Sequoia project has put together will be releasing a white paper earlier in the new year to share the findings, and we had more than 10 organizations come and present from Washington State, from New York State, folks in San Diego, really fantastic. And if you use the QR code on the posters out in the hall, you can actually look at all of those presentations. And what we want to do is take what we discovered this year and build toward a community of practice to just start solving on the ground some of these privacy and consent issues that can be solved. What can we do with the standards that exist? What kind of advice can we give to organizations on how to kind of up the game and move toward computable consent and privacy data segmentation to address, some of these things that intersect with information blocking and other things. Share what you can, but don't share what you shouldn't, right? So more to come on that, but that from Sequoia, from my own personal perspective, wearing that privacy and consent work group hat, is an area that I believe should be a real priority for ASTP, is to continue to move the ball forward on computable consent and ways to use computational power to really be able to fulfill individuals' privacy preferences. We do have a session on privacy tomorrow, so you'll learn more there. So back to another hot topic, cybersecurity. Last year was the largest and most expensive cyber attack and breach ever for the healthcare sector. And we are seeing more legislation on Capitol Hill thinking about how to prevent this in the future. What do you think? Will we have a cybersecurity bill in the lame duck session? Is this something that we could see early in the new year? Interested in where cybersecurity falls on the Hill.
Yeah, the magic 8 ball is telling me unlikely, right? 7 days, as Lindsay mentioned earlier. The probability of anything passing between now and the end of the year is unlikely. And I'll say, at this point, I'll talk to the House. The only vote that Speaker Johnson cares about is the January 3rd vote for his speakership, that official vote, right? We know his caucus has approved it, but before it goes to the House. So he's not going to pass any legislation that he doesn't know exactly where his caucus sits in terms of those votes. And while cybersecurity, I think, is a bipartisan issue, I think it holds a lot of promise for 2025 in the next Congress. I don't see it happening in the lame duck at this point.
Zeynep, any thoughts?
I would agree with that, just given the numbers, but in terms of cybersecurity generally, I think there is, again, a bipartisan support for something to happen at some point, and it just remains to be seen what that is. It's hard to speculate, but yes.
I'll add to that. No president, no leadership in Congress wants to have a cybersecurity breach, especially in a government agency, on their watch. So they will be talking about it a lot and often on a national security scale. So even though the recent one you just referenced was significant, there are far more dangerous cybersecurity threats that this administration will have to deal with. So I think it's going to be a priority. You might just not see it played out in the public sector, or I'm sorry, in Congress as wildly as some of the other topics that are more political. This should be something done with thoughtful folks in the room.
Well, let's take that over to the administration side, because we do have the potential, right, for updates to the HIPAA security rule. And we have had, senators write letters saying OCR you must. And some of the bills that we're seeing really sort of say OCR, please update, not really please, but update the HIPAA security rules. Do we think that will be a administration priority coming in, or might that become something we see a little later in the new administration?
It's a good question. I mean, I think, it all depends again on who sits in that seat at the director of OCR. But I will say that, to Lindsay's point, cybersecurity has broad appeal. There's a lot of concerns, a lot of heartburn around it, particularly with people's healthcare data sitting out there. So I could see a scenario where, the current proposed rule that's at OMB could get released. They get comments. But I suspect it's going to take a little while, because I also think about just the number of people that currently sit at OCR. It's not a very big office, right? They are often very understaffed. And so either way, my gut tells me it's going to take some time. Zeynep, I don't know if you...
Yeah, no, I agree. I was just thinking about that rule and what's potentially in that rule and what might happen once it's in the hands of a new administration. So, and again, it's hard to know. It will take a while. It took a while to get to where we are, even under the current administration. And so I think we have a ways. I think they were hoping to have issued it much earlier in the year, and to get it through. But here we are.
Now, I would just add that organizations can't keep their head in the sand and wait for the government to tell them what to do. You have to inform the government on what the threats are without obviously revealing it too much, and protecting, your IP and protecting your customers and your patients, but constantly informing the government so they actually know what's going on versus making up rules that they think will solve problems that may not be solvable.
So I want to leave a little bit of time for questions. So this is going to be my last question for the panel. And just very quickly, interoperability has been a bipartisan issue. And answer either, will that still be the case? Or how can we make that still be the case in 2025 and beyond?
So I love this question, because the past week I've been thinking about the picture that Mickey posted at the ASTP annual meeting last week that had all the national coordinators. And I think it was just a powerful image and a testimony to the bipartisan nature. I'll leave it to you.
No, go ahead. I was just counting. Was it 5 of them?
Yeah. And so, that offers, I think, a lot of promise to everyone in this room. So thank you for kind of reminding us of the fact that, we have a history here. But the reality is that when we have new Congresses and new administrations, there is a potential for fracturing of bipartisanship, because we all come to this game representing our different constituencies. And so, I think it's incumbent upon us to work together, and I think this community is at its best when we collaborate and work together to solve problems. And there's no greater testament to that than the Sequoia project itself. So my hope is that we continue to function in a bipartisan fashion, but I see the potential on those health IT adjacent issues like privacy, where we could see some fracturing and more partisanship.
I think that's a perfect response, and I'm just floating in my head the specific issues that could emerge to slow us down, but I think keeping this momentum and this energy intact is really the key, so I would just echo that.
And I would just say, looking at Congress, what they've done before when they did 21st Century Cures, going back, I was on the Hill when high tech was being developed, and I can remember working on the Small Business Committee, my boss had that position, and bringing in a clinician who was one of the only doctor's office to even have an electronic health record implemented in like a 100-mile radius. And so trying to even figure out what the word interoperability meant during that time, and then passing the high tech, I liked your art this morning too. I thought that was really interesting in terms of showing where we've come, where we were, where policymakers even understand this, how it applies to their day-to-day life, and it kind of finally does. I would say, looking at what they did with 21st Century Cures, the openness to having a Cures 2.0 and what they're calling a Cures, really is just Diana DeGette, because her counterpart has now retired from Congress. She's going to have to find another dance partner for next year if she wants to have a 2.1. And what could 2.1 look like? I mean, 21st Century Cures was 80%, nothing to do with health IT. The rest of it, was things that people praise and laud all the time. And the really complicated part was that percentage that is really what Mickey and the team at ONC and Don Rucker dealt with. So you could see a 2.1. And again, this is no heads in the sand. You need to be informing your policymakers, informing the new leaders of these committees about what's actually happening compared to what was happening during high tech, pre-high tech, all after meaningful use. And then applying your knowledge of the ways to make it more efficient. Because don't forget, keep DOGE in the back of your head. Because anything you say to the new administration, to a red Washington, you got to think in terms of efficiency, ROI, effectiveness, and number one, putting patients at the center of every decision that you make, everything that you report up.
Yeah, I would just add to that. Anna's presentation and panel earlier today is really, I think, the North Star, as you put it. It's what we should be aiming for, and I don't think that is going to be a divisive approach. I think it'll be, if we're all focused on the patient access, I think that in and of itself will get us to where we need to be and not divide.
Fantastic. And I was told that we were going to get an extra 5 minutes, so I want to use those extra 5 minutes for questions. I think we have some mic runners out there, so we probably have time for 3 questions or so. Don't be shy. You can also find us at the reception. We love to talk about this stuff day and night. So we've got a question up here. I think it's Devin. Yeah.
You look like an angel.
Angel of HIPAA.
Thank you. So you all talked about the prospect of privacy legislation coming out of Congress, but I just saw that the new head of the FTC was appointed, and they spoke a lot about what that's going to do to antitrust. Didn't say at all what was going to happen with privacy, and the outgoing commissioner was very, very assertive on privacy issues, particularly in the healthcare space. So any sense of where that portfolio might be going with the commissioner being elevated, one of the Republican commissioners being Ferguson, right? Andrew Ferguson?
Yeah, Andrew Ferguson.
Yeah. Okay.
I'm not taking that one.
Well,
FTC is like, that's a sticky wicket. But only thing I'll say is that it's basically known that the Trump administration is going to take a pulled back approach, generally on the aggressive approach the FTC took under the Biden administration. As it relates to privacy, they may say, actually, no, we need to take an aggressive approach because we want to protect. You got the Rand Pauls of the world out there chirping in the president's ear. Privacy is going to be a priority. I don't know if you want to add to it. You're totally well studied on privacy stuff, so please jump in.
No, I agree with your assessment.
Yeah, and we're figuring out what Andrew Ferguson's all about. I work with a bunch of corporations, and they want to know, because really the theme of everything is mergers, acquisitions, all of that, but underlying, how does that impact customers, consumers, and patients? That's going to be a key part. Thank you for the question.
And that's a really good reminder, right, that HIPAA governs health data held by certain organizations, but actually the FTC regulations at this point probably address more health data and information about individuals than HIPAA. So
Right.
good reminder, Devin. Other questions? They've got it all sorted.
Quiet audience on that. Okay.
All right, well, you will find us all at the reception, and thank you for your time and attention. Thank you to our panel.
Thank you, Chantal.